Good morning. My name is Joseph Ravenell, and I'm a primary care physician and a researcher whose focus is on how to improve screening in populations that have worse cancer outcomes. Almost 10 years ago, this month, my dear friend lost his fight with colorectal cancer. He was only 65 years old. He was a great man, a husband, a father, and a lawyer whose life work was ensuring that everyone who needed it had high-quality legal representation. He was also a black man. Black men in the United States have the highest risk, on average, of developing colon cancer and of dying from it because all too often we don't get screened early enough. And for colorectal cancer in particular, screening saves lives. My friend did not have to die from colon cancer like so many others. And had he been screened on time, I'm confident that he would have been here with us today. So why don't we get screened? Our research has revealed that fear, lack of access, and lack of awareness of the need for screening, and mistrust of the medical system are common barriers to screening among black men. We also learned that trusted people in trusted places within our communities and outside of the traditional healthcare setting, places like barbershops, can help to overcome some of those roadblocks to life-saving screening. The barbershop has long been a safe haven for black men, a place where we come together and discuss many topics, including health. We talk about what we can do to improve our lives. This kind of community hub is a place that can be an important platform for also fighting cancer. As an example, my barber, Denny Moe, when he lost his father to cancer, he fought through his pain and tried to think about how he could use his power and his platform to help his community fight cancer. Denny started an event called Cutting for the Cure. This was a 2-day event where Denny kept his barbershop open for 48 hours continuously and mobilized barbers to give haircuts around the clock in an effort to educate thousands of New Yorkers and to raise money for cancer research. Denny used his power and his platform to help his community fight cancer. I met Denny shortly after his first Cutting for a Cure event, and Denny's shop became the first shop in a large clinical trial that we ran to test if we could improve colon cancer screening among black men by training trusted community members and putting them in the barbershops to navigate men who had not yet been screened. We found that if the men were connected to one of these patient navigators, they were more than twice as likely to complete colon cancer screening compared to just a referral from their doctor. This is an example of the community mobilizing their power and their platform to make a difference. Thinking back to my dear friend who lost his fight with colorectal cancer, I often wonder if my program had been around when he needed to be screened. Could we have navigated him and saved his life? For those of us who are here today, we don't have to wonder. We don't have to say what if, because we are taking action just like Denny Moe, just like the countless community leaders who have mobilized their platform and their power.